Good afternoon, everyone. It's my great pleasure to welcome you all to this webinar that's co-organized by the Department of Global Public Health at Karolinska Institutet and the Swedish Center for the Impacts of Climate Extremes, Climes. And I'm Cecilia Magnusson. I'm an adjunct professor here at the Department of Global Public Health at KI. And I'm really excited by this webinar since it will give us an overview of the key findings of the very important 2024 Europe report of the Lancet Countdown on Health and Climate Change. I'll soon get back to our distinguished speaker of today, but first I would like to introduce my co-moderator and colleague at KI, Eduardo Pavoni. Eduardo, can you please help us with some housekeeping rules?
Great. Thank you. Thank you, Cecilia. And good afternoon, everyone. And thank you so much for joining us for this webinar. My name is Eduardo Pavoni, and I work as a project coordinator at the Department of Global Public Health at Karolinska Institutet. So the plan for the webinar today is to start with a presentation by our expert for about 40 to 45 minutes, after which we'll have some time for questions and answers for about 15 minutes. We strongly encourage you to ask questions, but to keep it nice and organized, we suggest that if any question comes up to mind during the presentation, you may use the chat box below, and we will go through the questions one by one at the end. If you prefer asking your question yourself instead, you're welcome to do so. Just wait until the end of the presentation and feel free to stick your hand out. So yes, thank you again for being here, and we look forward to this engaging session.
Thank you, Eduardo. And now it's my honor to present finally our speaker of today, Dr. Kim van Daalen. Kim is a career development fellow and environmental epidemiologist at the cardiovascular epidemiology unit of the University of Cambridge. Kim, you also used to be a postdoc at the Barcelona Supercomputing Center. That sounds very impressive. And we are so proud to have you here today because you actually co-led the Lancet Countdown in Europe. And we are looking forward to your talk today. Please, Kim, the floor is now yours.
Thank you so much, and thank you so much for that lovely introduction. I'm gonna attempt to share my screen again, so please give me a sign if you can see it. Does it work? Do you see it?
Yes.
Okay, perfect. Okay, then I will go ahead. Yes, so as introduced, my name is Kim van Daalen. I'm currently at the University of Cambridge. And before I was the lead author and one of the research fellow for the Lancet Countdown in Europe collaboration. And at the moment, I'm still involved as an advisor, but not the lead author anymore. So during this talk, I wanted to give a brief introduction to the work of the Lancet Countdown in general, and focus a bit on the 2024 findings, as well as discussing some of the policy and community engagement activities that we're doing, because the Lancet Countdown is not only focused on creating the science, but also on how can we translate this and how can we make sure that this is used by policymakers or by those people that we would like it to use. First, a bit of background. Of course, all of us that are probably in this webinar know that although human health has always been intimately connected to weather and the climate, that our climate has now been changing a lot more rapidly and a lot more dramatically than before. And this is affecting the environment that provides us with clean air, with food, with water, with shelter and security. And we see that populations around the world are adversely impacted by things as extreme weather events, air pollution, and heat waves. When we think about climate change and health, we've really started to realize that climate change is a complex and multifaceted issue that impacts nearly every single aspect of human health. And of course, it's not just heat what we're worried about, but what we're really worried about is all these different effects on our Earth systems that affect almost every single aspect of human health. So we can think about impacts on undernutrition, cardiovascular disease, vector-borne diseases. There's almost no health aspect that wouldn't be affected by climate change in one way or another. And of course, we also know that a lot of these health impacts are different among different population groups, often mediated by a range of different social mediating factors. And of course, to ensure that health systems are climate resilient, there's a need to monitor currently what the impacts are of climate change on health and health systems, and also what the progress is in terms of climate change adaptation and mitigation and the potential health co-benefits. Because it's not just talking about the impacts of climate change, but we also know that a lot of climate mitigation and adaptation actions can have benefits for human health. So I assume most people know what the definition of mitigation and adaptation is, but I will still briefly mention it. When we talk about mitigation, we talk about interventions to reduce greenhouse gas emissions or enhance carbon sinks. When we talk about adaptation, we talk about adjustments in natural or human systems in response to actual or expected climatic stimuli. And we know that there are a lot of different climate mitigation and adaptation strategies that are good for reducing emissions or adapting to climate change, but also are good for human health. So one of the famous examples is, of course, active transport. If we make sure that people exercise more, cycle more, walk more, it's likely that they are becoming healthier, but we have also less greenhouse gas emissions. The same thing with changing our diets, having less meat that we are consuming, all things that may reduce greenhouse gases as well as have benefits for human health. So recognizing kind of both the co-benefits of action as well as the impacts of climate change, that is kind of what the Lancet Countdown is trying to track over time. Just a bit more background, because I think that when we're talking about climate change, we should also always talk about the fact that climate-related impacts are not equal, nor is the responsibility for climate change. And of course, the Lancet Countdown in Europe focuses on Europe. And when we think about Europe, we know that Europe is one of the biggest historical and current emitters of greenhouse gas emissions. We've actually seen that until 1950, more than half of the historical CO2 emissions were emitted by Europe, and the vast majority of those emissions back then were from the United Kingdom. That was even up to 1882. That was the case, that most of the emissions came from the UK. And of course, over the century, we have seen that there was more industrialization in the US, and slowly we saw more contributions from South America, Asia, and Africa as well. But overall, Africa's regional contribution relative to its population size still remains very small. And one of the things that we've seen in the Lancet Countdown collaboration as well is that if we look at per person CO2 emissions in Europe, it's currently about 6 times higher than African and almost 3 times higher than Central and South American emissions. There was a recent Nature publication that some of you may have seen as well. It highlighted how climate injustices are persisting and how those that are least responsible often bear the greatest impacts both within and between countries. And they showed how greenhouse gas emissions from consumption and investment attributable to the wealthiest populations in the world have disproportionately influenced present-day climate change. So they link emission inequality over a period of 30 years, I think it was 1990 up to 2020, to regional climate extremes using an emulator-based framework. And they found that 2/3 of warming is attributable to the wealthiest 10%, meaning that individual contributions are about 6.5 times the average per capita contribution. So again, highlighting the unequal contributions to climate change around the world. And we of course see that also the impacts are not equal. Populations within and between regions are differently impacted. We see that across the world, but also within Europe, we see that different populations are differentially impacted. And populations most impacted tend to be those that are least responsible. So when you think about Europe specifically, we see that low-income communities, migrants and displaced people, ethnic minoritized people, range of sexual and gender minoritized people may be more severely impacted. And we kind of see that climate change is this health threat multiplier, whereby people that are already disproportionately affected by different social inequalities are after experiencing greater exposure to climate hazards, greater susceptibility, and have less ability to cope with or recover from, which kind of exacerbates these existing inequalities furthermore. One of my own interests is actually in the differential impacts that we see among different genders. So although the converse may be true in some places, in many regions in the world, we see that women and girls have increased health risks as a result of climate change compared to boys and men. And this is often the case because traditional gender roles may, for example, mean that women and their children spend comparatively more amount of time indoors. And if you use traditional cooking stoves, of course, that exposes them more to inhaling particles from the air pollutants. But there are a range of different other exposure pathways that result often in women bearing more risks than men and boys may. And I just wanted to give this as a bit of background because one of the things that we wanted to do in our last reporting cycle was try to focus a bit more on these inequalities and highlight how Europe is positioning itself in comparison with other regions, but also where possible, look at how the different impacts may affect different population groups within Europe. So a bit of background about the Lancet Countdown in general. So the global Lancet Countdown was born around 2015, and it was kind of a response to the need for monitoring progress towards ensuring climate change and mitigation and health benefits. So we are both looking at, okay, what are the impacts of climate change over time, as well as what is progress on adaptation and mitigation. And then each year since 2015, we have been publishing these indicators report that are looking at progress over time. So when I'm talking about indicators, I mean a measurable quantitative variable that is used to track or monitor trends in climate and health over time. And the hope is then that that can inform decision-making, interventions, and policy. And within the Lancet Countdown approach, we have 5 different working groups. And these different groups focus on different aspects of the Climate and Health Association. So the first working group focuses on climate change impacts, exposures, and vulnerabilities. So we look at things like heat-related mortality, we look at climate-sensitive infectious diseases. Then we have a group of indicators that is focusing specifically on adaptation, planning, and resilience for health. We have a group of indicators that is looking at mitigation actions and healthcare benefits. So for example, the reduced mortality because we are reducing air pollution. Then we have a working group that is focusing on economics, on finance. So for example, how does heat influence labor productivity? And then we have a working group that is focusing on politics and governments. And there we're looking at how different actors are engaging with the climate and health narrative. So how are EU parliamentarians mentioning climate and health? What kind of research is done in climate and health? So all 4 indicators fall within these 5 different working groups across the Countdown collaboration. And we're thinking about indicators. There are a set of criteria that we maintain to decide what is an indicator or what can be included as an indicator. Of course, they need to be meaningful, they need to be relevant, scientifically sound, and reproducible. So the methodology needs to be based on the current scientific literature, temporarily representative. So in the Countdown, we present all of our findings or all of our indicators on at least an annual basis. And we try to go as far back in the past as we can, up to a date as recent in the present. So for the 2024 report, some of our indicators are going back to the 1950s and then go up to 2022 or 2023, I believe. And then, of course, they need to be geographically representative. So within the Europe collaboration, we focus or we try to include all the 53 World Health Organization Europe countries plus Liechtenstein and Kosovo. In practice, of course, because there's differences in data availability, we're mostly focusing on the 38 countries that are part of the European Environment Agency member and incorporating countries, or the EU 27 countries plus the United Kingdom. And then one of the last criteria is there need to be reliable and updatable data sources. So these are some of the criteria to give you an idea of what decides what an indicator is or how an indicator gets included. Indicators are developed through different methodologies. So I've kind of divided it in 4 different ways of where our data come from. A lot of our indicators that are in working group 1, which is like focused on impacts, exposures, and vulnerabilities, they use a combination of climate reanalysis products. So usually things like ERA5 Land that captures different climatic factors and then combined with aggregated population data. So things as mortality data from Eurostat, and then use relevant models to track annual changes to develop a range of different health outcomes. So looking at heat-related mortality, heat risk during physical activity, climate sensibility for different infectious diseases, etc. A bunch of our indicators is also based on survey data. So that is filled out by local governments, cities, or national governments, and then feeds into the sections on adaptation or mitigation. And for the working group that is focused on how different actors engage with climate change and health, a lot of that is based on language models that then analyze different speeches or documents or scientific publications to have an idea of how climate change and health is being discussed. And then there's a range of other data that is provided by international organization, governmental bodies, or academic bodies. So just to give a very, very broad idea of what all the data is that feeds into this reporting. Of course, a lot of different regions around the world are experiencing different climate and health impacts. And more severe or less severe. So therefore, recognizing that the global Lancet Countdown has kind of been expanding to provide different regional centers that can specifically focus on those climate and health risks that are most important for them, or those adaptation and mitigation strategies. So at the moment, we have a center in Oceania, in Latin America, Asia, Africa, small island development states, as well as Europe. And I've been involved with your collaboration, so of course I will focus on that. But most of the other regional centers have published their first reports as well. Africa is due to publish their first indicator reporting next year. So a bit about Europe. In Europe, we already see that climate change is threatening the health of populations across the continent, leading to unnecessary loss of life. And as one of the largest current and historical contributors to greenhouse gas emissions, of course, Europe's response is crucial. And we also see that within Europe, temperatures are rising twice the global average pace. When we think about the Lancet Countdown in Europe, the collaboration officially launched in 2021. When we published our first publication highlighting all the different work that we've been doing. And then in 2022, we had our first indicator report that back then reported on, I think, 33 different indicators. And then in 2024, last year, we had our most up-to-date reporting that reports on 42 different indicators, which includes 9 different indicators. And we attempted to include more focus on equity and different vulnerable population groups or highlighted at-risk groups within Europe. Of course, given that we're using a lot of aggregate data, the ability for us to actually do that is usually quite limited. So for some indicator, we may have been able to do that, but for a lot, because of the framework and the different criteria that it is to define an indicator, we're quite limited with what we can do. So this is still something that we hope to develop further in the future. So we have 42 different indicators at the moment, which is a bit too much to go through in this webinar. So I thought it would be useful to just go through the different working groups and give 1 or 2 examples for each of the working groups to give you a general idea of what indicators look like, how they are established, and what kind of gaps there are still existing within our indicator framework. So the first group of indicators is focusing on climate change impacts, exposures, and vulnerabilities. So as you can see, we have indicators that focus on heat and health. We have indicators focusing on extreme events and health, like wildfire, smoke, and drought. Floods is still notably absent. We also have a range of different indicators focusing on climate-sensitive infectious disease, like Vibrio, West Nile virus, dengue, chikungunya, and Zika, leishmaniasis, ticks. We also look at the seasons of different allergenic trees, and we have an indicator on food security and undernutrition. All the indicators that are marked here or in any of the other slides that provide like an overview of all the different indicators in a section are indicators that are new or have a new component in comparison to the 2022 report. So overall, the idea is that with each indicator cycle, we of course improve methodology and show different aspects of the climate and health associations that the indicator is trying to monitor or assess. So this is an example of one of the indicators that fits in our first section. Of course, we know regular physical activity is a key component of a healthy, sustainable lifestyle. But when we are exercising in hot weather, this may pose a risk of heat-related illnesses, such as heat exhaustion or heat stroke. Faced with heat, physical activity might be suppressed or delayed to cooler times of the day. And this indicator is assessing the evolving patterns during which a person may experience heat stress risks when undergoing physical activity. So what we see overall is that heat stress risks during physical activity has increased to more hours of the day. So we can see that when we are looking at the figures here. This is specifically looking at medium intensity activity, so things like cycling, football, and tennis. But when we look at the earliest available data, that's the blue lines, then the second decade of data, and then the last decade of data, which is the red line, you very clearly see that the numbers of risky hours are increasing or spreading across the day. And we see that as well if we compare the last decade with the first decade, number of risky hours is substantially increasing. And of course, it's not a surprise that Southern Europe is most severely affected by this. One of our other new indicators is focused on leishmaniasis. Leishmaniasis is a climate-sensitive zoonotic disease caused by leishmaniasis parasite and transmitted by female sandflies. And most commonly, when people get leishmaniasis, that may result in things like skin sores, but in some cases, it can also result in fatality. And here we use a nested machine learning modeling approach to predict climatic suitability for leishmaniasis across NUTS 3 regions. So NUTS 3 regions are small administrative units. When we look at the figure here, we see the different NUTS regions, and we see the most light pink. These were areas that were only suitable in the first decade of data that we have available. So some of the regions here in Turkey. Then a bit more pink are regions that were suitable in both the first and last decade. And then the most darkest pink was only suitable in the last decade of data. And we see very clearly that there are new localities that become suitable more north of what was historically endemic, and that there was an increase in suitability predominantly in Southern, Western, and Eastern Europe, but it is spreading upwards. So these are two of the examples that were part of our section on impacts, vulnerability, and exposure. Our next section is focusing on adaptation, planning, and resilience for health. So here we have indicators that look at things at, do countries have national vulnerability and adaptation assessments? Do they have city-level climate change risk assessment? Do they have information systems that include an aspect of climate in health? Do we have information on green space? How are people utilizing air conditioning? So all kind of things are part of this section of indicators. So just to give an example, is this indicator that looks at city-level climate change risk assessments. Of course, we know within Europe, we have one of the world's highest densities of urban settlements, and therefore city-level adaptation and mitigation is crucial to build climate resilience. And in this indicator, we use data from the Carbon Disclosure Project and the International Council for Local Environment Initiative to show that in 2022, about 80% of the responding European countries had conducted a climate risk assessment. Quite a few of them are still in progress, and then for some of them, it will be undertaken in the next 2 years. And in this climate risk assessment, these different cities are able to indicate the things that they are most worried about. So some of the health issues that are often mentioned are heat-related illnesses, exacerbation of respiratory diseases, direct physical injury and death, mental health impacts, and health service provision. And they also mention different populations that they consider most at risks, which include older people at risk health groups, children and youth, low-income households, outdoor workers, all groups that shouldn't be a surprise to most of us. One of the other indicators in this section is looking at whether countries have surveillance system and early warnings systems that include climate information. So this is based on the 2021 World Health Organization Health and Climate Change Global Survey Report. There were only 22 European countries of the 53 that were participating, but they show that most of these countries have health surveillance systems for specific health outcomes. But some of them, only very few of them, incorporate climate information. However, for the early warning systems, a lot of them are climate informed. So most of that is related to, for example, heat-related illnesses that will be climate informed. Our third group of indicators is focusing on mitigation and the health co-benefits. So we have 5 different groups of indicators that are a part of this section. The first part is focusing on energy systems and health. Then we have a group that is focusing on air pollution and health co-benefits. Then a section focusing on sustainable and healthy transport, food, agriculture, and health, as well as health sector emissions and harms. So we know that energy systems remain one of the largest and single source of greenhouse gas emissions. And in this indicator, we use data from the International Energy to show that whilst Europe is making some progress towards achieving net zero emissions, its current trajectory is consistent with achieving carbon neutrality only by 2100. So that's when you go along the trend that we're currently seeing. We also see that the combustion of fossil fuels amounted to about 3.4 billion gigatons of CO2 per year, and that in Europe, like said previously, the per person emissions is 6 times higher than African per capita emissions and 2.7 times higher than Central and South American emissions. So still highlighting the disproportionate contributions to climate change that we see across the world. Of course, we also see that health systems are a substantial source of greenhouse gas emissions and air pollution. And we tried in this indicator to monitor both direct and indirect healthcare sector emissions using a multi-region input-output model combined with national healthcare expenditure data from the World Health Organization. And we see that there was actually an increase in per capita healthcare greenhouse gases compared with 2010. And we also saw that there was substantial regional air pollution related to European healthcare that was estimated to result in an additional 540,000 dailies in 2020. This is a graph that is showing the per capita healthcare sector greenhouse gas emissions against the healthy life expectancy at birth as a proxy for health system performance, just to illustrate that you do not have to have a very high greenhouse gas emissions per person to have good health system performance, meaning that a lot of countries can probably reduce emissions without sacrificing any impacts on human health. In our fourth indicator sections, we are mostly focusing on economics and finance. So we're trying to look at the economic impacts of the health impacts of climate change. Sorry, 1 second. Okay, sorry, I was briefly disrupted, but I'm back. In this section, we're looking at economics and finance. So we're both looking at the health-linked economic impacts of climate change and mitigation, as well as the economics of the transition to zero carbon economies. So we have things as economic losses due to climate-related extreme events, change in labor supply, the impact of heat on economic activity, but we also look at the net value of fossil fuel subsidies and carbon prices, as well as clean energy investment. I do want to say that in this section specifically, we're really looking to expand our analysis and be able to develop more indicators that are really linking economics with health, because for most of these indicators, it's still mostly economics and climate, but the health component is included a little bit less. So I very much welcome ideas for new indicators or new types of analysis for this section as well. So just to give an idea of the indicators that are in there now, due to climate change, the intensity and frequency, timing and duration, as well as the spatial extent of extreme weather and climatic events are changing. And the direct impact of these extreme events are, of course, on human health, but they may also impact infrastructure, public service provision, and impact different socioeconomic determinants of health, particularly at risk regions. And in this indicator, we use Swiss Ray data to track economic damages, both insured and uninsured, for example, in relation to infrastructure. There isn't a very clear trend over time, but there's only data on about 10 years of extreme events. But we did see that in 2022, there were a lot of economic losses due to weather-related extreme events, estimated to be around 18.7 billion. We also have an indicator that is looking at the net value of fossil fuel subsidies and carbon prices. The idea is that placing adequate carbon pricing can internalize the cost of climate change in economic decision making and set economic incentives for transitioning to a decarbonized economy. However, when we look at Europe, there are still very many European governments that continue to subsidize fossil fuels and that lack carbon border adjustment mechanisms, increasing the levels of health harming emissions. So, in the 2024 report specifically, we saw that only 32 out of the 53 World Health Organization European countries had carbon pricing mechanisms in place. 29 of those had net negative carbon emissions. That means that they were providing net subsidies for fossil fuels, so accounting for both the subsidies as well as the pricing. And only 14 countries had net positive carbon prices, which means that they were discouraging fossil fuel use. And if we look at the whole of Europe, the net fossil fuel subsidies still amounted to 61.6 billion in 2020. And of course, that is a number that we would like to lower very much. Our last section of indicators is focusing on public and political engagement. So here we are looking at how different actors are engaging with climate health. So we have the scientific engagement, individual engagement, political engagements, corporate sector engagement, as well as media engagements. Given a lot of us are scientists in this webinar, I thought I highlight specifically the coverage of health and climate change in scientific articles. So this indicator tracks academic publications on climate change and health in Europe over time using machine learning classifying applied to an open access database, OpenAlex. And we see very clearly that the scientific literature on health and climate change has rapidly expanded since the early 2000s. So you see like a huge increase in scientific literature. We do, however, see that most of these studies are still focused heavily on impacts, with a very few of them focusing on mitigation and adaptation specifically. So these were just a few of the examples, but of course we have 42 different indicators in the report. So what we try to do is standardize some of these to create an overall figure. So for each of the climate-related indicators, standardization was applied, which you can see here. But overall, when we look at our different indicators for the impact indicators, response indicators, and engagement indicators, we see that there is an upward trend in health-related hazards, exposures, and vulnerabilities, and that there is a lack of sufficiently ambitious adaptation and mitigation strategies in Europe. Overall, our report has several conclusions. I think most of these are probably not a big surprise, but one of the major ones is the climate crisis is already happening. It's not a far in the future scenario. It's already impacting the health of European populations. But at the same time, we still see that many European countries remain major contributors to greenhouse gas emissions, as well as still providing fossil fuel subsidies despite the health harms that this has had. And of course, failure to take decisive action may exacerbate existing climate change impacts and lead to missed opportunities for considerable healthcare benefits in the short term. And these interconnected health impacts tend to be unevenly distributed among populations due to differences in exposure, sensitivity, adaptive capacity, often reflecting intersecting patterns of socioeconomic development, marginalization, and historical and ongoing patterns of inequity. So when we look overall at our report, we've seen that most of severe impacts are actually happening in Southern Europe. We have been able to look at some differences for some of the indicators at different population groups where the most deprived areas were most severely impacted. But this is analysis that we're hoping to still expand on in our future reporting cycles. But of course, indicators are not actions on itself. So all this information hopefully feeds into policy making and decision making on climate change and health, and developing interventions that can actually address these problems and make sure that we reduce greenhouse gas emissions and adapt to the health effects that we may already experience or will experience in the future. So we have different ways of collaborating with multilateral organizations and policy organizations to find ways to translate the science beyond an academic publications in different other routes. So we are currently a partner of the European Climate and Health Observatory, which is a collaboration with a range of different organization, and it's led by the European Commission, the European Environment Agency, and their aim is to provide countries with data and suggestions for adaptation specifically. So it's more focused on adaptation rather than mitigation. And one of the things that we have been doing is providing or indicators as interactive visualization. So when you go to the observatory website, you go to indicators, you find about 15 of our indicators as interactive visualizations. So you can look at changes of the indicators over time. You can zoom into specific countries. We're trying to lower or make the resolution higher for many of our indicators there, so that you can also actually look at specific cities or not regions instead of only looking at an entire country. So that is one of the things that we are doing. We're also contributing to a range of different policy reporting that is in cooperation with a lot of the actors that you see here. So our indicators have contributed to a range of these different policy reports. But we're also working with NGOs and like medical organizations to develop local policy briefs. So for example, we work with KLUK, which is an organization in Germany, to develop a policy brief for Germany specifically, which is highlighting some of the data at the German level and then making specific policy recommendations, entirely led by KLUK, as they are the local experts on Germany. We also have generating, I'm just going to skip and come back to that. We have also been generating country data sheets. So rather than only providing the policy briefs, which can only go into detail in a few aspects of climate and health, we provide more detailed data sheets, which is just based on the data for a specific country. So for example, the different climate and health indicators from working group 1 are summarized for Spain. We have the different on air pollution, extreme weather events, infectious diseases. And this is hopefully more useful for a specific country policymaker to see what the health profile is for their country. And we currently have them available for 14 different countries. And we're consistently working on improving those and developing these further and hopefully making them more impactful. One of the things that we've also done is try to develop different infographics to engage the general public more. So people that know less about climate change and health, we have made infographics for each of our different indicators that kind of provide a basic understanding of, okay, climate change may impact pollen in this and this and this way, or climate change may impact climate suitability for leishmaniasis or West Nile virus in these ways. And of course, because in Europe we have many different languages, we have translated them at the moment in Spanish, French, German, and Italian, and we'll probably keep translating them as we know more languages. But you can find all of these online on the different websites as well. So there are 42 ones in English, and these are all there are about 12 in the different other languages. We also have a publication that is due to be published in a journal that is specifically focusing on communicating science to a younger audience. So we have created a publication that is explaining the results of the Lancet Countdown in Europe to an audience of children aged 12 to 14. And that is accompanied with a range of different visualizations that also try to explain to a younger audience how climate change is impacting our health, but also how climate action has positive impact for human health as well. Because it's not all doom and gloom. There are also positive aspects of taking action, which is one of the things that we're really trying to emphasize. This is just to highlight what our current Europe team is at the moment. Catherine Tan from IS Global and Joachim Rockcliffe from Heidelberg are the new directors. They recently moved into their positions, and Heidi and Jose are the research fellows that have taken over my former position. And these are all for different working group leads, focusing on the different teams in our publication. Just to give you a bit of an idea of the next reports that you can expect. We have our next general indicator report published next year in 2026. And then an urban scale report, which is specifically focusing on or indicators on cities specifically. And these are led by Heidi and Jose. So I will give a very brief idea of usually how new indicators come into our reporting cycle in case that is of interest for people attending here. But usually when new indicators are being proposed, the authors of these indicators write what we call a white paper. So we have a specific template for that. People come up with a proposal that then goes through an informal peer review process. So we have external people outside of the collaboration looking at the proposal, assessing that. And if that is deemed scientifically sound and relevant for the region, then that indicator gets approved to be incorporated in the reporting cycle, and the new indicator gets added. So we had our white paper submission for the 2026 report was closed in December or something, and the urban scale report was recently closed. But when we have our next reporting cycle, there will be another call out. So you can follow the Lancet Countdown in your LinkedIn if you have an interest in potentially developing indicators part of the collaboration. And of course, you can always reach out as well to discuss potential ideas. We have lots of different collaborating institutions. Our last report had about 69 collaborators from over 40 institutions across Europe. I'm sure that there are many of you that are affiliated with one or more of the institutions on this slide. But without all of these collaborators and all these institutions, of course, the work wouldn't be possible. And that's it. So I would like to open for questions or discussions or suggestions now. You can contact me here, but you can also follow our work on Blue Sky and LinkedIn, and you can find the report by scanning this QR code. And looking forward to questions and comments.
Thank you so much, Kim. That was a comprehensive yet very clear presentation of all that data and all the background. I'm sure the new Dr. Van Daalen, Heidi Kriet, will have now big shoes to fill. And now we welcome all to join in interaction and take the opportunity to ask questions about this important work.
Yes, in fact, we already have a question from Shonda. I apologize if I misspelled the name. And they ask, if we wanted to become involved at the country-specific level, who will we contact to volunteer or liaise with, as the policy briefs does not include some countries and languages?
Yes, that's a great question. I mean, we welcome anyone that would like to volunteer to help expand to further countries and languages. So you can reach out to the europe@lancetcountdown.org email address. I will just put it in the chat here. You can also reach out to me, and I will bring you in contact with Catherine and Joachim. Here, you can email this email address. But we always welcome any ways to try to expand or reach in the national countries. Yeah.
I can also see that Karen is asking a question here. Are you considering including indicators tracking transnational climate risks, such as supply chains and migration in the future?
I think we are very willing to include any indicator that has any link to climate and health, because our goal is to provide a most comprehensive overview as possible of all of the different ways in which climate change and health interact, both from the impact level as well as from the mitigation and adaptation level. Because as we know and we have seen, the Earth system is affected in so many different ways and is impacting almost every single aspect of human life. That to provide and to get a good idea, we need to get an as comprehensive overview as possible. So if you have ideas, feel very free to get in contact, and we can see what is possible. I think one of the trickiest things that we have seen in the past with developing new indicators is how possible it is to develop indicators that are annually updatable and available for lots of countries in Europe. So for example, one of the things that I'm very interested in is heat-related maternal impacts and neonatal impacts. But a lot of the time, we don't have the data for that on an annual level to develop a model for the whole of Europe. So there are lots of things that we would really like to cover, but because of the indicator framework, it's quite difficult to actually make it work.
Great, thank you. We also have another question by Asim. Can you kindly guide us that what is the net growth of the world overall, keeping in mind that the overall work that you have done?
Net growth. Maybe this needs explanation.
Yes, perhaps Asim, if you want to step in and elaborate on that question a little more. The net economic growth.
Okay. I'm not sure I can quite answer that question. I would love to have been able to answer that question, but I'm not an economist myself. So if there's any economist in this group, maybe they would like to take the question. But I'm really sorry, I cannot answer that myself.
I can take the opportunity and ask you, Kim, whether you think the European region sticks out in any ways that you were surprised about, not considering perhaps that we are this extremely high income type of setting, but were you surprised by anything else in the results of these indicator analyses?
Yeah, I love that question. I think one of the things that I'm not sure I was necessarily surprised by it, but some of the things that I find that but something that I find very important to recognize is that Europe is not a monolith. It's not like we have so many different countries in Europe, and Southern Europe is very differently affected as Northern Europe or Eastern Europe. And we have also different adaptive capacity or mitigation capacity. And especially if we compare the EU 27 with the other European countries. So I'm mostly one of the things that sticks with me, and one of the things that I always like to communicate is that we have major sub-regional differences within Europe itself and also within different population groups. And of course, that's not something that we have been able to highlight as much as we would like to. But I do think that it's important to realize that even though in comparison with a lot of other regions, we may have more adaptive capacity, there's still lots of population groups that are more impacted and maybe less able to adapt. And we do need to account for that and make sure that these climate impacts on health are not just keep increasing the health inequalities that we're already seeing within Europe.
Yeah. Thank you.
Asim is actually asking another question. What would you suggest to do if we have such huge impact of climate change in the short run? I'm assuming he's asking what kind of actions we can take in the short runs to tackle such strong impacts.
Yeah, I think it's not a one answer for every impact in every country. Within Europe, we see that different climate-related health impacts are more important for one country than for the other. Dus I think one of the first things is, of course, assessing what are the most important risks and then responding to that as a government, as a country, to make sure to reduce those risks as much as possible and adapt to those. And at the same time, of course, reducing emissions. I think we cannot get around that we need to reduce emissions if we want to stop or at least slow further climate change down. So that is the most that I would be thinking of. But if other people have other things that they want to bring in, I'm very happy to hear that as well, of course.
I was actually wondering myself, you showed us that only 13 countries in the EU provide um, like carbon emissions subsidies to
Oh, yeah, I see what you mean. Yes.
yes, exactly. I was wondering if you
Yeah.
could if you could specify what those countries are that are providing some incentives for citizens to lower their carbon emissions.
Yeah, so there are 13 countries, 13, 1, 3, sorry for my accent, countries that are indeed discouraging emissions. I don't actually know by head which countries those are, which is very bad. I'm not sure if the Netherlands, which is the country that I'm from, is actually one of those. But there are very few countries in Europe compared to all the 53 countries that we have that are discouraging it. Most of them are still subsidizing fossil fuels, and overall Europe is still subsidizing it. I think I said 60 million or 60 billion that we still see in terms of net subsidies in Europe. So I think that is indeed I think the most basic things is to discourage people using fossil fuels. That would be one of the major steps that we could take. Definitely, that's a good point.
Okay.
Great.
I have many questions,
Yeah.
but we also have an extremely audible audience with us today. I know many of you are very knowledgeable and may have better questions than I do.
Yeah.
So
Claudio actually is typing in another question. What would be a simple but not simplistic way to summarize such a complex situation at national and subnational level in Europe, having in mind decision makers in Brussels?
Yes, that's a great question. So one of the things that we hope helps summarizing this is our data sheets, to kind of give an idea of climate change is impacting health in all of these different ways, specifically for your country in this way, or for your country in this way, or at a European overall level. However, we are currently trying to find ways that this can be communicated easier. So thinking about doing stakeholder consultations to actually talk with policymakers of what is the type of information that you need from this big academic reporting. Because of course, I think we all realize that policymakers are very unlikely to read this full academic report. So what we do have as well is, if you look at the executive summary, it's about 2 pages, but it's a lot more of a storytelling of the different impacts of climate and health and our current status on mitigation and adaptation. And we've also translated that in 6 different languages. And that is something that has become a lot more accessible as a summary of this complex situation. So we have some progress of what we're doing in terms of the data sheets and executive summaries. But I think we still need to find a right format of indeed being able to summarize and communicate this clearly. So if people have suggestions, we're always very open to talk to people and see, okay, what can we do to make this message really stick with people? And one of the things that we've also noticed is that focusing on the health co-benefits of climate change mitigation is very positive as well, because thinking only about negative impacts is not always as sufficient to stimulate ambitious action. But when people actually think about, oh, but if we take these actions, we also increase both environmental impacts as well as healthcare benefits, that may actually stimulate more action. So there's kind of different approaches that we're taking, but I think we can still do a bit better on that.
I was thinking, I was learning recently that the politicians in the different countries and even in Brussels to a lesser degree now are mentioning climate change in their different bills and discussions and speeches. Because of the situation with the war in Ukraine and in Gaza and the situation with the Trump administration and everything that's going on. Have you got any, this is also a very big question, but any advice on how we can reignite the interest in the climate change in light of this new situation, sort of, as you have so well argued that there's a win-win thing with climate and health, also perhaps alluding to the win-win situation of the civic unrest and what the climate change may do with that, and that it's all interconnected. Sorry for this big
Yeah,
question.
that's an incredibly big question.
Yes.
I'm not sure if I can fully answer that. I do think that in general, one of the things that makes climate change so difficult to talk about is that many people see it as something that is far in the future. So when we have competing interests. And of course, when there is a war going on or when we have to deal with the Trump administration, those are seemingly a lot more acute than a far in the future or something that is perceived as a far in the future problem. So I think when we can talk about climate change and be more specific and show like, hold on a minute, it's actually impacting human health right now, and it's only going to get worse if we're not doing something, whilst also showing, okay, but all of these actions can have positive impacts on human health. And of course, we also know that climate change can also exacerbate conflict. It can exacerbate violence. We see during extreme events that gender-based violence may increase, for example, but also if there's less access to food, we see more regional conflicts. So there's all kind of ways that all of these things are interlinked, and trying to connect those and highlight those may be one route, but I don't really have a very clear answer on this because I think it's very complex. And especially with the unpredictability of what's happening in the US, you never really know how to prepare, how to respond. So it's very complex. Do you have any ideas?
I was just thinking to pointing towards this win-win bit
Yeah.
you were so nicely describing now. And I think there have been some success in linking the climate work to health in terms of what we eat is also good. It's good for us and good for the climate data. The active transport is good for us, good for the, and use of this.
Yeah. Great. Thank you very much for such insights. And thank you everyone for joining us today for this webinar. I think we could really wrap this up as a very meaningful experience.
Indeed. Thank you, Eduardo, and thank you so much, Kim. Applause to you. And I would also like to say to you, please keep the lookup for additional webinars like this in this series. And I will keep it. Yeah, thank you so much. Big applause for you, Kim, and thank you.